I'm Amy Ntoburi, one of the Certified Nurse Midwives from Olmsted Medical Center. I will be speaking to you about physiologic birth and how the Certified Nurse Midwives at Olmsted Medical Center can partner with families to experience a safe, healthy pregnancy, labor, and birth experience. At Olmsted Medical Center, our Certified Nurse Midwifery service has a primary or first cesarean rate of 8% last year. In the years since we've been in existence, our rate has fluctuated between 6 and 11%. Our rate of induction of labor or augmentation of labor, giving medication to strengthen or make the labor contractions more frequent, is 17% on average. We recommend induction of labor at 42 weeks gestation or earlier only if medically necessary. We perform non-stress testing and amniotic fluid index testing 1 week past your estimated due date. This will help us ensure the safety of continuing pregnancy. We support skin-to-skin bonding with mother and baby or support person for at least the first hour following birth. We encourage breastfeeding in the first hour following birth as well. We want to partner with you and your family with the mutual goal of being a healthy, safe birth for mom and baby. Another word for normal birth is physiologic, meaning supporting the body to perform the functions it was designed for. Here is a busy slide that basically says women's bodies were made to birth babies, and we allow the mother and baby to work together to labor and birth without unnecessary interventions. If medical complications arise that require intervention, we will try to honor the body's processes while continuing to provide safe care. From the statistics I cited earlier, you should understand if an operative birth would be in the best interests of the mother and baby, we would advise you this is the route to go. What can families do prior to labor and birth to enhance physiologic birth? A great resource is the American College of Nurse Midwives consumer website called Our Moment of Truth at ourmomentoftruth.com/category/pregnancy. I always recommend our childbirth education classes at OMC as well. It's important to recognize and evaluate your personal views and thoughts about pregnancy, labor, and birth. What have you heard or been told by your mother, aunties, friends? Unfortunately, negative stories are common. Someone else's experience will not be yours. A positive, realistic attitude and view of birth can enable you to participate without preconceived ideas. Simply being aware of your beliefs and attitudes about pregnancy, labor, and birth will help you work through the reality. There are differences between OB physician care and certified nurse midwifery care. We have a great group of obstetricians at OMC, but the care we provide is different. Nurse midwives view pregnancy, labor, and birth as normal body processes, not a medical condition that needs to be managed. During the labor process, the midwife will provide support during the active phase of labor. We are present during the pushing phase of labor as well. The physician will come to ensure the labor is progressing and will be present when the baby is crowning and is born. We have excellent labor and delivery nurses who are there to support laboring families. Another nurse will be in the room at the time of birth in order to have a separate nurse to ensure both mother and baby are well cared for. Throughout your pregnancy is a good time to determine who you would like to provide support to you during labor. The person or people who know your desires and will be able to see you coping with labor and be your cheerleaders are the right people to choose. Someone to change the cool washcloth on your forehead, provide low back pressure during contractions, hold your leg during pushing, and cutting the umbilical cord after delayed cord clamping are the people you want to choose. These people are not there to watch, but to be active participants in the process, encouraging your efforts. Our current group of certified nurse midwives at OMC consists of me, Annie Schwanke, and Suzanne Cooley. We are currently in a transition phase and are actively interviewing and in the hiring process for 2 full-time certified nurse midwives. Typically, this occurs 37 to 42 weeks to be considered a term birth. Preterm would be a birth before 37 weeks of pregnancy. We will offer membrane sweeping at 40 weeks of pregnancy. Evidence shows that serial membrane sweeping can reduce the need for labor to be induced with medication. Side effects could be annoying cramping that does not progress to labor, spotting type bleeding, pain or discomfort from the sweeping. As I mentioned, we give time to allow your body and baby to start labor on their own. We do provide tips to encourage labor to begin that you may try at home. In order to support the natural progression of labor, we recommend being active, changing position throughout labor. Being active throughout your pregnancy may also help with labor progression. Walking daily, prenatal yoga classes, like those at OMC, would be some good examples. Such as freedom of movement, having those you feel loved and support from in your presence. We encourage you to meet all of the midwives in our group as we take turns being on call for labor patients in the birth center. We encourage a tour of the birth center prior to labor in order to feel comfortable about where you will be during this life-changing transition. As long as baby's heart rate is normal, mom's vital signs are normal, we can provide intermittent monitoring of the baby's heart rate. In the early phase of labor, this would mean listening with a Doppler 1 minute prior to the start of a contraction, during the contraction, and 1 minute following the contraction. If we hear a slowing of the heart rate or something unexpected, we would recommend listening with the fetal monitor for a longer period of time for reassurance. We encourage snacking, eating, and drinking during labor in order to maintain your energy and to have energy when the time comes to push your baby into the world. We are able to attend births while you stand at the side of the bed, are on hands and knees in the bed or next to the bed, on the toilet or on the bathroom floor, or submerged in the tub. We have 2 designated water birth rooms at the birth center. All families who elect for this option need to meet criteria during the course of prenatal care and take a water birth class. We review a consent form prior to labor as well. As I mentioned earlier, we support the golden hour, where bonding and breastfeeding may occur. Any vital signs that need to be assessed may take place while the baby is next to the parents, as long as the baby appears healthy and is breathing without working too hard. There are numerous benefits to parents and baby, such as aiding in babies maintaining temperature, transitioning to breathing air, easier feeding, less crying, calmness during potentially painful experiences, increasing breastfeeding success, decrease in depression symptoms and stress during the postpartum period for mom. For more information about midwives and pregnancy, visit ourmomentoftruth.com. Thanks for your attention and interest.